Hello everyone, in today's video we are going to discuss about how to identify gallbladder polyps and stone in ultrasound. Here in this image we can see this structure is the gallbladder. So this is the longitudinal view of the gallbladder. So in the anterior aspect of the gallbladder, this homogeneous structure is the liver. So gallbladder is located in the gallbladder fossa of the liver. So we can see this is the fundus of the gallbladder, this part is the body of the gallbladder, and here is the neck of the gallbladder. Normally the lumen of the gallbladder should be echo-free. So normal gallbladder should be anechoic like this. But here is the hyperechoic structure. And if we trace the posterior aspect of this hyperechoic structure, we can see there is some shadow. So there is some black area posterior to this hyperechoic foci. If we see any hyperechoic structure with posterior acoustic shadow inside the gallbladder lumen, then this is the gallstone. Okay. Here is the transverse view of the gallbladder, and again in this view we can see there is hyperechoic structure inside the gallbladder lumen with posterior acoustic shadow. So this is the posterior acoustic shadow. Normally, if we change the position of the patient, then the gallstone actually moves from one position to another. So we can see this is the echogenic foci in the lumen with posterior acoustic shadow and moves with changing the position. Remember, it should be hyperechoic, there should be posterior acoustic shadow, and this should be mobile. So this is the normal gallbladder. So there is hyperechoic structure inside the lumen of the gallbladder. So if we see the posterior aspect of this hyperechoic structure, there is no posterior acoustic shadow. This foci does not move from one position to another on changing the patient position. So this is the gallbladder polyp. So this is another image of the gallbladder polyp. The non-mobile hyperechoic structure without posterior acoustic shadow is the gallbladder polyp. So if we see single gallbladder polyp, then we have to search for other polyp, because sometimes patient can have multiple gallbladder polyp. There are multiple polyps in the anterior gallbladder wall as well as posterior gallbladder wall. So non-mobile echogenic foci without posterior acoustic shadow in the gallbladder lumen, this is gallbladder polyp. So this is the transverse view of the gallbladder, and normally the gallbladder lumen should be echo-free. That means it should look like this. But here is some echogenic structure inside the lumen of the gallbladder. So if you look the posterior aspect of this structure, there is no shadowing. Here in this image, there is a similar structure without posterior acoustic shadow. But here we can see there is echogenic structure with posterior acoustic shadow. So if we compare the echogenicity of this structure with this structure, this is more echogenic. So echogenic structure with posterior acoustic shadow, this is gallstone. But this structure is less echogenic than this structure, and there is no posterior acoustic shadow. If we change the position of the patient, both of this structure moves. So this is gallbladder sludge. So this is less echogenic than gallstone. Gallbladder sludge moves with changing the position of the patient, and there is no posterior acoustic shadow. So friends, remember, mobile echogenic structure with posterior acoustic shadow is gallstone. Non-mobile echogenic without posterior acoustic shadow is gallbladder polyp.